My name is Madeline Seal, and my partner and I, Kelsey Zeringue, are going to be talking about our D&P project, which was on remifentanil infusions and comparing those to epidural anesthesia for labor pain. Epidural anesthesia has long remained the standard of practice for treating labor pain. When epidurals work, they work really well and have considerably rare adverse events. However, not all women are candidates for epidural analgesia. Some women have allergies to anesthetic agents, blood disorders, neurological disorders, or variations in their anatomy that prevent them from being able to receive epidural anesthesia. Or sometimes epidurals just don't work as well as we want them to. Maybe mom can still feel one side of her body. Gender disparities in women's health care still exist today, in addition, especially when it comes to treating their pain. Studies have shown that women have longer wait times in doctor's offices and the ER and are prescribed less pain medication. Our goal with this systematic review is to shed light on another option for treating labor pain in women to ensure that even women who can't get epidurals can receive some kind of pain relief during childbirth. Remifentanil is a potent and ultra short acting opioid analgesic. It can be given as a continuous infusion to treat pain, and because of its metabolism by nonspecific plasma esterases, it has a very fast onset and offset, which can lessen the risk of typical opioid side effects such as apnea. To assist in our research, we applied Catherine Kolkaba's comfort theory to our topic. This theory explains that comfort, including the treatment of pain, is a fundamental patient need that can significantly impact outcomes. Kolkaba also explored how physical, psychospiritual, environmental, and sociocultural contexts play a role in patient comfort. By comparing epidural anesthesia to remifentanil infusions for pain relief during labor, we've aligned our project with Kolkaba's perspective by seeking to understand the best way to provide comfort to pregnant women during labor and delivery in a holistic manner. Our goal for this study was to determine if intravenous infusions of remifentanil could be a safe and effective alternative to epidural analgesia for childbirth. We included studies from 2017 to 2023 to analyze safety, side effects, and efficacy. We also sought to identify existing gaps in the literature to promote further research on this topic. Existing literature was reviewed and synthesized to determine the safety and efficacy of remifentanil compared to epidural anesthesia for labor analgesia. Articles were screened for inclusion using the PRISMA criteria and diagram for updated systematic reviews. Inclusion criteria consisted of studies that focused on the safety and/or efficacy of remifentanil infusion versus other methods of analgesia for labor pain in pregnant women. Exclusion criteria involve studies that were published before 2016 and those involving non-pregnant individuals or pregnant individuals with specific conditions such as preeclampsia or gestational diabetes. We performed an exhaustive search of the literature in September of 2023. A previous systematic review was completed on this topic in 2016, so we only included articles after this date in our study. We also decided to include all possible study designs in order to synthesize the most information possible. After our initial search, we met with a university librarian who helped us to ensure we were using the most efficient and accurate methods. A total of 73 articles were discovered, and of these, 7 were chosen for inclusion in our review. Literature selection was guided by PRISMA criteria for updated systematic reviews. We included articles if they focused on efficacy and safety of remifentanil infusions on maternal pain relief during labor compared to that of epidural analgesia. Articles were excluded if they involve women with specific conditions like preeclampsia and gestational diabetes, were published before 2016, included animals, only focused on one mode of analgesia, pain relief was not discussed, or if the comparison of remifentanil to epidurals was not made. After analysis, 12 articles were assessed for eligibility using the JBI Critical Appraisal Checklist, and a total of 7 articles were chosen for inclusion in our study.
Now for our results and discussion. We had 2 major themes throughout the systematic review. Theme 1 is the effectiveness of remifentanil infusions for labor analgesia. Blodgett et al. Compared combined spinal epidural analgesia with remifentanil patient-controlled analgesia. the combined spinal epidural analgesia showed significantly lower pain scores and higher maternal satisfaction. The remifentanil showed satisfactory analgesia but was associated with transient respiratory depression. Gelting et al. Compared remifentanil PCA with epidural analgesia. Remifentanil showed lower maternal satisfaction, although no significant difference in maternal adverse effects were reported. Wendell et al. Compared epidural methods versus fentanyl or remifentanil PCA. Epidural method showed superior maternal satisfaction, and remifentanil and fentanyl PCAs showed to be less effective. Yan et al. Compared remifentanil-assisted epidurals versus epidurals. There were higher comfort scores in the group that received remifentanil-assisted epidurals, and lower visual analog scale scores for pain in the remifentanil-associated group. Our second theme is safety and side effects of using remifentanil infusions for labor analgesia. Lee et al. Compared remifentanil versus epidurals. There was a faster onset of analgesia with remifentanil, but it was less stable. There were no significant differences in adverse effects or maternal satisfaction between the two. Lotenberg et al. Showed that adverse events related to remifentanil for labor were rare. Mothers and neonates recovered completely without lasting deficits. Murray et al. Compared remifentanil and epidurals. There was a higher rate of normal deliveries with remifentanil. Epidurals were associated with higher rates of instrumentation and cesarean deliveries. There was no significant difference in APGAR scores at 1 and 5 minutes. Now for our conclusions. We concluded patients who used remifentanil infusions for labor analgesia had comparable pain and comfort scores to those who received epidurals. No statistically significant differences in adverse effects in maternal and neonatal patients were discovered when using remifentanil. Further research is required to identify safe and effective dosing when used for labor analgesia. We concluded that a more robust study to determine the presence of long-term effects of this analgesic method on both mother and child would be difficult. Given the current evidence, remifentanil cannot be recommended as a standard of care for labor analgesia. However, for situations in which epidural anesthesia is contraindicated, remifentanil infusions could prove to be a viable option. We identified limitations, strengths, and challenges. For strengths, we had a comprehensive methodology. We also had a thorough literature search with adherence to PRISMA criteria. We included a diverse range of study designs from several different countries. Stringent criteria was used for study selection and inclusion. We did extensive analysis that was reviewed by a chairperson of the doctoral committee. Limitations included quality of evidence discovered, potential bias in several studies, no randomized control trials or other high-level studies were found, and comparability between studies is limited due to the differences in study design. As far as challenges, standardizing all findings proved to be difficult due to the varied definitions and measures of pain relief and pain satisfaction across all studies. Now for our recommendations. The PICO question was partially answered based on the available literature due to many studies providing lower quality evidence and no standardized dosing regimen. We recommend initiating higher quality research, such as randomized control trials, to gain further insight and quality evidence into the effectiveness of safety of remifentanil for labor analgesia. In addition, further research could be performed focusing on an optimal dosing of remifentanil for labor analgesia. Wendell et al. Reported various doses of remifentanil used in some of their included studies, but no studies reported a specific optimal and effective dose of remifentanil for the purpose of labor analgesia. A standard dose will be required and must be established before recommending remifentanil as a standard of care for labor analgesia. Lastly, studies that could determine the long-term effects and safety profiles in diverse patient populations would be a beneficial addition to this topic. The studies included in this review only focused on pregnant women without significant comorbidities such as preeclampsia and gestational diabetes. Now for implications for practice. Currently, epidural and spinal anesthesia are the standard of care for labor analgesia in pregnant women. It is too premature to recommend remifentanil as another standard of care. However, remifentanil is a potential option for patients in which epidural anesthesia is contraindicated. Having remifentanil as an option for labor analgesia provides another method of individualizing an anesthetic plan to meet the specific needs of each patient. Implications for research. We believe that further research should be done on remifentanil infusions for labor analgesia before there are standard of care recommendations. Specifically, a standardized dose of remifentanil to be used for labor analgesia should be established. We believe discovery of effects of remifentanil infusions for labor analgesia on neonatal health at the time of delivery are of utmost importance. Gaps in the literature that should be further studied include long-term outcomes, effects on specific populations, dosing guidelines, and maternal and fetal monitoring guidelines. As previously mentioned, more randomized control trials on this topic would provide clearer evidence on the safety and efficacy of remifentanil. In addition, research could be done on the economic factors of using remifentanil analgesia compared to epidural analgesia for mothers in labor. This additional research could guide clinicians to make evidence-based care decisions that are safe and patient-specific. This concludes our presentation of our systematic review. We have included references for your review. Thank you.